Hi everyone, my name is Helene Couvrette. I'm a certified yoga therapist. I'm a yoga educator. I teach 200-hour, 300-hour, and 800-hour trainings. I'm certified in pain yoga, and I know that some of you are having a hard time. I'm here to do a little series for yoga for isolated times. I'm going to do a little practice now for our hips. I have another one for the neck, shoulder area. So I hope this will help you with your tight hips. Maybe you've been walking, which is also a really good thing to do at this time, keeping your distance, of course. So this one is going to be accessible to anyone because you can just use a chair. I'm going to back up. And I have a pillow in front of me here, as you can see, because sometimes, like me, we might have shorter legs. And if you have your knees lower than your hips, this is actually quite a nice old chair, and it's very low, so I'm happy with it. But I still need a little lift. You want your knees to be as high as your hips. So if you have anything you can put underneath, it could be a cushion, it could be a few books. It really helps already alleviate any stress in the lower back. And lower back and hips are very connected. So, but I'm going to focus on just loosening up some hips for a little bit. So grab that chair and sit back. Just start by relaxing a few moments, just taking some breaths to really be present and let go any of the energy it took you to just get the chair and come sit. So close your eyes and just do a few big, longer exhales. And then try to make those exhales a little softer, a little smoother. All right. So I'm going to try to loosen up the hips a bit. We're going to take our right leg and just give it a hug. And I like to loosen up the ankles as well while I'm here. Why not do extra body parts? And then go down and then take the other one. So just this to start. Do ankle circles and then bring it down. And once more, you're going to do that. And then just pull it a little more towards you without forcing or straining. And make sure your shoulders are not working too hard. Keep them down. And release. And take the other one again. And release. You can also be doing this on the floor, by the way. I just thought I'd go for the chair, since some people with hip issues need a chair. It's hard to sit on the floor when we have tight hips. All right. So the next thing we're going to do is just take ourselves and sit back on the chair, lift the leg, and just straighten, and then bend and bring it up on its own and straighten. And if this creates any pain, then just go back and hold it. All right, so I'm just moving the joint of the knee, but I'm also moving the joint of the hip, which is this area right here, as I'm doing that. And then I'll do the other one, so I'm bending and straightening and bringing the knee bent and up and straightening. I'm going to use the hands. If you feel it's too much and your hips don't feel comfortable, don't strain. And keep with your breath as you're doing it. All right. Now let's bring the knee up and just go back, outward and inward. So back and forth, or I should say side to side. Just loosening it up. My knee's a little higher. I'm lifting it up. And I'm going to take the other one. I'm leaning back on the chair. I'm watching my breath. I am hugging my belly a little bit. That helps stabilize. And bring that down. All right. Just go in and out with the knees. Take your feet a little apart to do that. Just let them go in and out, in and out. And by the way, this is my yoga top and my jammy. It's my lounge wear. I'm committed to doing yoga and jammies during isolated times because I'm convinced most of us are spending time in our jammies. And I just want to make this joyful and playful as well, because it's already a hard enough time. So I like being a little goofy, and much to my children's chagrin. I embarrass them often, and I take great pride in that. So now what I'm going to do is bend the leg again. I'm going to flex the foot. I'm going to grab that ankle and bring that shin on my leg. So I'm not putting the top of the foot, which would really twist my ankle. We call this supination. I'm going to take my bottom of my leg bone, and I'm going to put that there. And because I have a little knee issue, it's very nice to flex that foot. It helps line up muscles there, and I don't want to get too techy. Just know that basically flexing the foot is very helpful if your knee has a little issue with this. Now you might end up looking like this, and that's fine. What we're going to do is just take our hand, often people end up on the knee, but try bringing your hand down the leg right near the hip joint. So if I turn sideways, you'll see that my hand is here. I know it's hard with the door. Let me lift the pajama top. So I'm bringing my hand down much more closer to the hip, because that is where I'm actually trying to open. So I keep my foot a little flexed, and I'm pushing the thigh bone close to the hip, gently down. And I'm going to, at the same time, try to lift the thigh into the hand. I'm making sure that this shoulder is calm and that I can breathe calmly. And I'm just activating a muscle, a little resistance. So my hand is pushing down and my leg is going up. My hand is much closer to my hip than my knee. And I can breathe calmly, smoothly. When you find you're struggling, try to go a little softer with the breath. Take a little longer to exhale. And although I'm pushing thigh and hand and hand and thigh, I'm doing it maybe 2% or 5% of the ability to do so, where I can talk this calmly to you. So don't put a lot of force in it. Then let that go. And then just rock your leg a little bit. Just let it release. We're going to do that again. So put your hand right up on the hip. Press gently into the thigh bone right near the hip. My hand is right about where this one is showing, not here. And I'm pushing my thigh up gently, just at this little easy, comfortable place. And I'm going to watch my breath. Notice if my shoulders are strained. Make sure they're calm. Calmer breath, smoother breath. And just make that activation just enough for you. Not where you're creating stress or any pain. Just a little lift up into the hand and a little push into the hand. I'm using the same hand on the leg. I know you can't see it, but that's where it is. I'm going to rock that out again. And I'm going to take that leg down. I'm just going to notice how I feel when I move this leg back and forth. Just be aware of the sensation on one side and the other. All right, so now, of course, I want to do the other one. First, take the leg here. So try to avoid grabbing ankle and kind of torquing the knee on the way up. First, bend the knee. Flex the foot will also protect the knee joint. It just stabilizes it in a better alignment, and I'm going to take my thigh bone right there. My shin bone right there on my thigh, and I'm going to breathe. This hand again, I'm going to show you what this one is going to go down towards right near my hip joint. So if I turn sideways here, you might be able to see better. So I'm going to do this. I'm going to flex, and I'm going to bring it here, and my hand's going to go right down here. And I'm going to make sure my shoulder's not up. I'm going to relax it. I'm pushing my thigh up and my hand down, and I'm just doing this at a very light and easy amount of strength. It's very little, and I can breathe calmly. So think of this more as a marathon than a sprint, and it's just sending this kind of relaxation response. I'm trying to keep these very layman friendly, not get too technical, but just know there's actually a physiological reason that the muscle then kind of lets go. And then you can just shake that out. I'm going to come back and face you. And so we'll do it a second time. So keep your knee there, or your ankle there, and push it gently near the hip joint and bring the leg up. So you're not just pushing, you're also using the leg to counter that. Make sure that the shoulder's relaxed and your heart is lifted, and that you're just sitting back, gently having what I call a push of peace. So the leg is going into the hand is going into the leg. I think of it like a tug of war, but since this is yoga, I rather call it the push of peace than the tug of war. So I'm going to do that, and I'm going to let that go. And I'm talking away, just trying to stall while you're hopefully holding on to that gentle push of peace activation, so that time goes a little bit more easily for you, because we want to hang out there for a few breaths, like maybe 10 breaths, and now just see how it feels to bring those legs and just wobble them out. All right, I'm going to actually stand up now, so I'll get rid of this pillow, and I'm going to use the chair. Now, this is a great chair, except that it's not so stable, so if you have a stable chair, that's great, and if it's not stable, just make sure that you're aware of that, because you don't want it to tip. So just see how you feel in your legs, and we can actually do a couple hip circles. Remember the hula hoops way back when? And I'm going to let my knees bend so that I'm not straining them. And I'm going to do a hula hoop the other way. Now if you notice, my whole upper body is moving with this. So what I'm going to do now is try to do it without the upper body moving. So can you keep your hands maybe on your shoulders and think more of a belly dance here and go one way then the other, right? That might not be so easy for some of you. So we want to loosen these hips. And another thing I'm going to do is just see if I can access tipping my sit bones up and then down. And I'm using the belly to tuck that tailbone because this is often a cue used a lot, but it might make some of you squeeze in the top hips and low back. So loosen the seat muscles, tip this way, as if you want to lift your sit bones up and then zip the belly up to tip the hips this way. And can you do that with your hands on your ribs and not have the ribs move? It's fine for your knees to bend, but can you move your hips back and forth? And if you find that difficult, actually, let's go on our hands and knees. Sometimes it's easier here. So it's really just a pelvic tilt. So if you see the middle of my back isn't really doing too much, the hips may give a different angle in the low back, but I'm just moving my hips. So not a typical cat and dog where the whole back is, just the hip bones. And to have this shape, I am not squeezing in the low back or top hips. I'm actually just zipping my belly in. So that's how I let my belly drop and hug my belly in. That's how I'm moving in this way. I'm zipping my belly and pelvic floor and then releasing it. So see if you can get that happening in your hips. And then let's try it again standing up. So now that you've done it there, can you put hands on ribs, and just notice if you can release the belly and then zip the belly and release the belly. So just finding that. Then go ahead and hula hoop out again. Trying to keep those ribs and shoulders stable. So I'm leaving my hands on my ribs instead of shoulders to really see if I can isolate those hips. All right, just notice how you feel. Okay, take a few breaths. Now I'll go back to using the chair. So what I'll do is I'm going to take my one leg on the chair. And if you need help, you can always reach for the chair, bring the leg up. Once you're there, see if you can stand and just notice. Just to get that length in the back. Now I'm going to ask you to put your hands on your hips and bend by pushing the sit bones back. So I'm not bending at the lower back, I'm just taking my hips back. I'm going to put my hands here and just drop into that leg. Now you might be able to just bend bend the back knee and go back and forth this way. Right, now if you can move further back and just keep that back leg straight and go back and forth. What I'm doing is thinking sit bones going back, sit bones going forward. Right? If you can't get this far back and keep the back leg straight, and I'm going back and forth because I want to loosen it up. And if you want, of course, we're going to do the other side. So again, you might reach for the chair before you bring your leg up. You might not be able to go too far back, so for those who can't, just bend the back knee, so the front one bends more too. And think of the movement as your hip going forward and your hip going back. My hip going forward, my hip going back. If you can move your foot further, keep that leg straight, and move the hip back, and move the hip forward. Hip back, hip forward. When we move our joints, we have synovial fluid in there that is designed to help us so that we get a little bit more loose. Let's release that. And as you move them, the synovial fluid is stimulated and more liquidy than sticky. And often if you wake up and you feel stiff, it's because it kind of stiffens overnight. So movement then chews it up. I think of it as chewing gum. Chewing gum is hard when you buy it, and then it gets soft as you chew it, of course. Then if you leave it, it gets hard again. We don't want to chew it again, but it's that kind of idea. That's just what comes to my mind. So I'm going to bring the chair back, actually. We're going to use it for those who need it. So we're going to take a nice inhale up, bend our knees, and again, I'm thinking of the hips going back. I'll put my hands here. I'll bring one foot under the chair and the other leg back, and I'll be on the knees. So it's a similar action we just did, but we're lower. So I'll move the chair forward. Some of you might still need it. And if you see my front ankle, I want to keep it under the knee. So as I bring my hips down, I want to make sure my knee's not quite going way forward. So I'll walk my foot forward and slide it forward so it's ankle under the knee, and I'll drop in the hips. You can hold the chair. If you want, you can hold the floor, and I'm going to drop. Now sometimes what happens is people tend to round and I'll drop here, but make it about the hips because you kind of want to keep the spine straighter and focus on just releasing the hip. So whether hands on chair or hands on blocks or hands on floor, try not to get all curled into it. This is actually lifting my hip, if you notice. When I lift my head, my hip can drop, right? So do this for the hip, and then I'm going to go back and forth. Now as I go back, I'm going to lift these toes up and then bring them down. So essentially my foot is flexing as I go back, and don't try to make that front knee super straight and push it down because that can strain that joint. So my knee is not super straight. I feel the back stretch right now. So right now it's super straight, but it strains that joint. So instead I'm going to go back and forth and keep that little bend in the knee because I want to protect the knee and I want to loosen the hips, right? And I'm going to keep my spine from bending too forward by keeping my head up. Just dropping my head will round my spine. So leave your head up. Focus on the hips. You can use a chair. You can use the blocks. Bring the chair closer might help. And then I'm going to take that leg back, and I'm going to take my pajama leg down, and I'm going to take the other leg forward. It might be hard for you to do, so go ahead and grab it with your hand, whatever you need to. Bring that ankle right under the knee, and then you're going to go back and forth, and back and forth, and then just stay there for a breath. Use your breath. Soften it. And inhale and exhale. Flex the foot. I forgot about that one now. And then flex the foot. And I'm thinking of my hips. All right. Now I'm going to put that knee down. And I'm going to take my knees wide. My toes are together. I'm going to sit as close to my heels as I can, and I'm just going to rock my hips. Just rock them. Just notice how that feels. And then I'm going to come down on my forearms, drop my head now, and I'm going to still rock my hips. Then I might stop rocking them and just be here. So this is a nice, easy way to loosen the hips. Hopefully that was accessible to all of you. And again, if you've got bigger issues and you want to talk about it privately, just give me an email and or look on my site, www.homyogacenter.com. Center is spelled E-R, in case that is important for your server. And know that I'm going to keep doing more of these videos. I also will be putting together a series of workshops, specialty workshops, that'll be longer and explain a little bit more on shoulders, knees, hips, and back, and hopefully help people who are having a hard time meanwhile with these freebies. And I hope you're staying well, breathing calm, and do a little movement every day. It's sunny right here, right now, today. And so I hope to continue having you view all these videos. I have more on my YouTube channel, Helene Couvrette at H-OM Yoga Center. Wishing you all well and a wonderful day.